So one area of interest is obviously using immunotherapy in cholangiocarcinoma. Currently at this time, based on the TOPAZ study, immunotherapy is being used in first-line setting in combination with gemcitabine cisplatin, where there's improvement in overall survival and PFS compared to the standard arm of gemcitabine cisplatin. But at our institution, actually, we studied the single-agent immunotherapy with Nivolumab in a refractory setting a couple of years ago. This was a phase 2 study of using Nivolumab in refractory cholangiocarcinoma. We had about some 50-some patients, which was eventually published in Immuno-Oncology. However, the response rate was only 10%. So once again, the question is which of those, which of those patients are actually responding to the immunotherapy. So for that study, we did have a pre-treatment tumor specimen available. So, based on the specimen that we had, we were able to do some translational work, doing whole exome sequencing and RNA sequencing and immunohistochemistry for some of the biomarkers to sort of figure out, to analyze which of these patients actually benefited from the immunotherapy. And what we did find was that the PD-1 expression on tumor, the CD8 T-cell infiltration, and high ratio of CD8 T-cells and Tregs in tumor microenvironments were significantly associated with prolonged progression-free survival. While the PD-1 expression on lymphocytes and CD68 macrophage infiltration in tumor microenvironment really had no predictive role. Also, based on the RNA sequencing, we were actually, able to come up with this 6-gene model that was predictive of patient to benefit from immunotherapy. So the patient who had this 6-gene predictive model had a sort of longer prolonged PFS compared to patients who did not have those gene signature. And once again, I think this is a very small set of studies, but clearly it tells us that there's certain tumor microenvironment that can potentially be predictive biomarkers for immunotherapy, such as Nivolumab. So obviously, the further larger study needs to be done to confirm these findings.